Ohio ranks second in the nation for having the most drug overdose deaths. The main culprit, fentanyl. But it may surprise you to know just how difficult it is to test for it. Our senior health correspondent Monica Robbins reports on a local doctor just published in the New England Journal of Medicine for his call to improve fentanyl testing.
Can't see it, smell it, or taste it. And usually there was never an intent to buy it. Since 2013, fentanyl is the driving force behind drug overdoses. And now most street drugs are laced with it. The problem's so big, Ohio decriminalized fentanyl test strips this year so people could check to see if their drugs were tainted. But it's still not stopping the overdoses. And usually the person never has a clue they were exposed.
It might come as a surprise to many people that when somebody goes to a hospital for an overdose in the United States, only about 5% of them are actually tested for fentanyl.
Because fentanyl requires a different type of test that many hospitals don't have. Cleveland Clinic addiction specialist Dr. Barnett co-wrote a perspective piece in the New England Journal of Medicine, outlining the need for easier fentanyl testing.
Many people are using things like methamphetamine, cocaine, and they have an overdose and they don't understand why. So there are good fentanyl tests out there. The problem is you have to send them out to a lab to get them analyzed. And so it can be 24 hours or even several days before the results come back. And so that's not really useful to us clinically.
Last year, the FDA approved this device that can test for fentanyl in minutes. But hospitals must have a federal certification as a high complexity lab in order to get one. Barnett says there's a simpler answer already on the street.
There are actually good urine dipstick tests for fentanyl that already exist. You can buy these in the U.S. People use them to test their own drug supplies. The problem is they have not gone through testing with the FDA to be approved as a laboratory technique, and so hospitals can't use them.
Now, we are fortunate that our larger hospitals here have the capacity to test for fentanyl and get results within a couple hours. But that's not the case with smaller systems and some suburban centers. So that's why this is an issue.
And I'm guessing it's obvious that folks should know if they've been exposed to fentanyl.
Absolutely, they should know. From a public health standpoint, Barnett says that the patient should know what caused their overdose and the potential for addiction. And that knowledge may also help them decide if they want help or at the very least to test their supply in the future. And what's worse is there are newer drugs hitting the streets that are even stronger than fentanyl and even more difficult to test for. So you'd think this long into the epidemic that testing would be on track.
Yeah, it remains very scary, certainly.
Does.
Okay, Monica Robbins, thank you very much.
Sure.